Welcome to Getting Your Dream Smile with Cosmetic Dentistry. This is where we discuss and help patients get what they want in a smile while being totally informed. Whether it is porcelain veneers, bonding, whitening, or Invisalign, you'll find out what is best for your situation. Everything you should know, where and who to see, and all the costs involved. Stay tuned.
Welcome back to Getting Your Dream Smile with Cosmetic Dentistry. My name is Sabrina, your co-host for today, and I'm currently a pre-dental student at UCSD. I work with Dr. Eshom to inform the public about the best ways to achieve your best smile with cosmetic dentistry. Our podcast discusses the benefits and what you need to know about cosmetic dentistry. Today, we'll be talking to Dr. David Eshom, who has been practicing cosmetic dentistry for 25 years as a credentialed cosmetic dentist from the American Academy of Cosmetic Dentistry and specializing in minimally invasive cosmetic dentistry. Dr. Eshom loves sharing his recommendations when it comes to getting a great smile. And today, we'll be talking about what you need to know during a consultation. Let me introduce to you Dr. David Eshom.
Thanks, Sabrina, and thanks for putting this all together so that we can share this information with those patients out there that are looking to improve themselves with cosmetic dentistry. I know we've talked a lot about how to choose a cosmetic dentist and how you look for one, but I'm really excited about today's topic because we're going to talk about what you should expect when you visit a cosmetic dentist, and that I think is a very important subject also because if you're choosing a cosmetic dentist, you're kind of building a relationship that starts and you can't really break that relationship if you start in the middle of cosmetic dentistry and decide you change your mind. So it's really important for you to like your cosmetic dentist. And I think today's topic, meaning the patient cosmetic consultation, is an important part of you deciding whether you want to get in that relationship with your cosmetic dentist. So to start with, I want to let people know outside that it's important for you to kind of get a feeling of the office that you're going to. It's kind of like when you're meeting somebody for the first time. Will you initially like them or you initially don't like them? And so it's the same when you're choosing a cosmetic dental office as when you get on the phone with them. You want to make sure that they are calm and peaceful and there to answer your questions and give you the information you need. You don't want to have someone who answers the phone be, very hurried or curt or even rude, because that's probably going to be the atmosphere in the office. Mm-hmm. So you don't want to do that. So you want to be greeted warmly also when you get to the office. And you want that person that is interviewing you or taking your health history to not just hand you a clipboard and then expect you to fill it out. So, here at our office, we actually fill out the health history for our patients, and we ask about them and we tell them about us and give them some good information about us before they even meet the doctor. So does that make sense to you, Sabrina? What other things can you add to that?
I think the biggest thing is making sure that you feel comfortable where you walk in. Like, the first impression means everything in like any situation, especially in this situation with finding your cosmetic dentist. So I think getting that great first impression of the office and the atmosphere is super, super important. So what are the next steps then after you get a feel for the office for your consultation?
Well, I think the next steps should be you meeting the doctor, mm-hmm. and then them saying, hi, and them understanding what you're there for. They should have an idea of why you're there and what you told the front office. The patient shouldn't have to repeat what they've already just told the office staff. That the doctor should know that already. Mm-hmm. But it gives then at that point, when you meet the patient, you should hear a little bit more and hear maybe more in their words what their chief complaint is. Yeah. And then the doctor should understand that and kind of repeat it back to the patient so that they show that they understand. So that should be the next step. And then after that discussion, it usually turns into information or fact-finding kind of things. Mm-hmm. And so in our office, we take pictures of our patient actually 16 different pictures of their face and their mouth and their teeth. And so for the viewing audience out there, you'll see the pictures we take. And for our listening audience, I'll describe what those pictures are. And so the first picture we take is a picture of their lips relaxed but slightly separated, just so we get an idea of where their teeth fit within their lips. Mm-hmm. Then after that, we take a picture of them smiling, straight on, close-up smile. And that way we get to see how their teeth fit within their lips, because whenever you're doing cosmetic dentistry, you want that smile picture to look the best. And so you want to envision how those teeth are going to fit within that person's lip so that they have what we call ideal display. Mm-hmm. And ideal display means they display their smile nicely. And so we also take that picture of a side view of their smile, so we see how wide their smile is. And then we take some pictures that are more revealing with holding their lips back and then close-ups of their teeth. And in the picture we're looking at on the screen here, this patient wore their teeth very, very badly for somebody as young as himself. He's only 35 and probably his teeth are 65. Yeah. So he came in, with that concern, and we talked about, some cosmetic dentistry for him. But he was even more disappointed to see his teeth, in this way. But it's important for the patient to see this, to understand their condition, so that they can decide whether they want to do cosmetic dentistry or not, and how big of a benefit it will be for them. Did you have some comments on that, Sabrina?
I think it's so important to take pictures, because even with me, and I had Invisalign when I got my pictures taken, I didn't realize just how bad my teeth were and how crooked they were, and like even the little minor chips. So I think making sure that you see a doctor who really understands your case and looks at the fine details is super important, because you might not even know yourself what else you might need in terms of cosmetic dentistry. And so these pictures are super important and super insightful to not only you, but the doctor.
Yeah, and they're important to me as a doctor, for my treatment planning, for my smile design. So I'm going to how I'm going to help the patient have a better smile. Exactly. But they're very important for me, for the patient to see them with me, so that they can see what I see. Because I don't want to describe a problem and the patient think, well, I don't really have that problem. Yeah. If a patient feels like they don't really have that problem, then they need to explain to the doctor that they don't understand why they're doing this or why they're fixing that. Mm-hmm. But when you have pictures like this, the patient sees exactly what the doctor sees, and then they understand it much better that way. So that's why these pictures are important to me, and they're important to the patients, because they develop a great sense of communication. And then you should be developing trust of the doctor that's talking to you at this point. Mm-hmm. So next I'll go through the pictures a little bit more, because right in the middle of the pictures, we take a picture of the patient biting. And this picture is very important, because a cosmetic dentist should understand how to make your teeth look nice, but almost more importantly, they should understand how to make them fit and be functional and long lasting. Mm-hmm. And so when you see somebody's bite, like we see the bite in the picture that I'm showing now, and for our listening audience, what it is someone biting directly onto their front teeth with their lower teeth. And so they hit end to end their lower teeth. And so if a doctor wants to explain to this patient that they need to have their chips and their teeth lengthened because they've worn them, the patient needs to understand that you just can't lengthen them without doing something on the lower teeth, because if you lengthen them, the lower teeth will either break themselves or they'll break off whatever you make for the patient. So the bite, and understanding the bite, is really important as a cosmetic dentist and a patient.
Okay.
Any thoughts with that, Sabrina?
I think that's super interesting, because I didn't really realize how your bite can affect cosmetic dentistry. And I feel like patients can sometimes think it's just a one-way street, where it's like, oh, I just want to fix my teeth and get it over with. But there's so many factors that you have to take into account, and that you have to ensure that your doctor takes into account to really know that you are getting the right doctor and you get the best look possible.
Yeah, and a lot of patients want to come in and they just have their 2 front teeth or their 4 front teeth and they want them fixed. And maybe they've been worn and chipped, but there's usually a reason why they've been worn and chipped. And it's because of them either clinching or grinding or the way they bite. And so when you go and take somebody's teeth that are 30 or 40 years old and you instantly make them look like they're 20 years old, you have to take into consideration how they're going to bite. And it usually has to do with the way their lower teeth hit the upper teeth. So understanding that compatibility is important.
I bet.
So that's another important picture. And then we take a picture of the patient's teeth looking down on them, like if you're on the patient's tongue, so we can see how well they're aligned or how much they're worn, and whether they're crowded, and so forth. And then the last picture we take is the picture of the full face of the patient smiling, so we can see how their teeth fit, again, with their whole face. Because it's one thing to have the teeth straight when you're looking at them up close, but really what's most important is how people see you. And so you want to see how the smile looks, not only in comparison to the lips, but how it parallels the eyes and how it should be perpendicular and how it fits, the midline of the face, so that it fits that way symmetrically. And so that's a very important part of the consultation process, is to have pictures. And I think for you, Sabrina, we took those pictures and we went over them with you. So maybe you can tell the audience what it was like when we went over your pictures, and add on to what you've already said.
Yeah, when I took my pictures with Dr. Eshom before I got my Invisalign, he basically guided me through what would happen with my Invisalign and how he would try to straighten out my teeth. One thing that I was concerned with is that I was super crowded and other people had told me to pull out teeth, but Dr. Eshom had informed me of how he would make room within my mouth to straighten my teeth and make sure they were all aligned without having to pull out any teeth, which was really great for me because I didn't want to have to go through that. And then on top of that, he noted little things such as my gum lines and how boxy my lateral incisor teeth are and how I could fix that with gum laser recontouring. And I thought that was really interesting because I'd always noticed that I had a gummier smile, but I couldn't pinpoint what it was that I really wanted to change. And going through that whole process with Dr. Eshom and having him explain to me every single little thing, every tooth, every movement was super, super insightful for me. And at that point, I was like, okay, you know what? I can definitely trust Dr. Eshom. And I feel like his expertise is up to what I want in a doctor. And I knew that from then on, I was in good hands and that I would eventually get the perfect teeth that I've always wanted. So I'm always happy to go over that experience and just be confident that I chose a good dentist and one who would inform me throughout the entire process.
Well, thank you, Sabrina. Those are kind words. But I realize that the audience out there isn't necessarily from San Diego. Of course, you're always very welcome to come here. But when you're looking for a cosmetic dentist, you should have that feeling like what Sabrina had, is that this person understood me. They went over these pictures with me. They explained what the problems were. They addressed your chief complaint.
Yeah.
And then after going over these pictures, then you need to look in the patient's mouth and do an exam. And as we do an exam, we kind of take notes as to what might not be correct and what can be improved. And so the patient gets an idea of what the doctor's thinking at that point. And then we sit the patient up, we go over the pictures that I just described. And then at that point, you, as a doctor or as a patient, you want to maybe add your thoughts to the doctor's thoughts. And then between you and the doctor, kind of collaborate as to where you want to go from there. Because it's important for the cosmetic dentist not to be dictating the treatment. It needs to be a collaboration, or what we call a co-diagnosis. So again, another example that I'll share for the people on our viewing screen is this patient that came in. And she originally came in to talk about her two front teeth. She was in her early 60s, and she was very fit and very concerned with her look. And she felt like her teeth have been moving, over the past years, and she wanted to kind of have those two front teeth corrected. But as I got to talking to her and showing her that, if we just worked on those two front teeth, that they would be too narrow to try to fit back into her arch. We'd have to thin them too much.
Yeah.
And then talk to her about how her teeth don't display very much. And then talk to her about, the possibility of improving the color and discussing, her frustration with whitening. She decided that, hey, maybe then I should work on, maybe some more teeth so she gets a broader and a wider smile. And so we offered her Invisalign, but she felt like Invisalign would surely straighten her teeth and widen her smile, but her teeth would still be dark.
Mm-hmm.
We talked to her about bleaching, and she said she had bleached a lot, and this was the widest she can get. And then we showed her that what other patients had done with their teeth like hers, and how a broad white smile really changed them. And at that point, she kind of decided that she wanted to do a little bit more than just work on the two front teeth, and that she kind of wanted wider teeth than she could possibly have. And so we decided to do veneers for her to do a smile makeover. And so the reason I bring that up is that sometimes the patient comes in and talks about their main problem, and the doctor should work on solving it. But if you can't solve it, they should tell you why. And if they can't solve it, they should tell you some options. And so in this instance, I gave the patient an option of just working on 4 teeth and keeping the color of the teeth she had, because we'd have to match the sides. And then I gave her the option of working on 10 top teeth so that we can widen and straighten and give her the white that she wants. But I kind of left that information in her lap for her to decide what she'd want to do and what would be best for her in her circumstances. So I think it's important for the patient and the doctor to collaborate during your consultation and come up with a plan that the patient chooses based on the different options that the cosmetic dentist gives them.
Yeah, I think that's super important because at the end of the day, it is your smile. So you do want to ensure that you get what you want. And if you come across a doctor who has their vision and really is trying to push it on you, you should maybe be wary that your voice isn't you're getting across, because you want to get a smile that both you will enjoy and the dentist will enjoy. So be sure to always work with your dentist to get that perfect smile.
Yeah. So yeah, I think that's important. Is it should be a collaboration rather than a dictatorship.
Yeah.
So after the patient has a couple different ideas, I think it's important for them to understand what are the pros and cons of what they're doing.
Okay.
So one of the things that patients like to know is how much it will cost. And so the cosmetic dentist should be able to tell the patient, well, with 4 teeth, it would cost this, with 10 teeth, it would cost that, or with Invisalign, it would cost that. And then the cosmetic dentist should go over, well, what other costs are involved? And I've spoken about this through all my podcasts, is that there's just not a cost for cosmetic dentistry in terms of money. There's also a cost in cosmetic dentistry in terms of how much tooth structure you might have to pay or lose in order to have the cosmetic dentistry. So there should be a discussion of whether there'll be any tooth grinding or any tooth destruction in order to place veneers, so to speak, in order to straighten teeth, so to speak. So there's a cost that way. And then there should be a discussion of the time, how long it would take, and then what the appointments would be like, and whether there would be any pain or discomfort involved. And then along with, what the total cost is. And at that point, usually I leave it just directly to the patient and say, well, what do you think? And how would you like to proceed?
Okay, well, that sounds great. And then sometimes, will the patient come in, and I think one of the main things is that they want to have an aesthetically pleasing smile. But is there any benefits beyond just the aesthetics of the new smile that you can get with cosmetic dentistry or shifting your teeth?
Well, that's a great question, Sabrina. In terms of Invisalign, if someone chose Invisalign, there is both a health benefit and a cosmetic benefit. Again, majority of the people come in for the cosmetic benefit, which is a nice wide smile
Mhm.
and straight teeth. But I also tell them that they get the health benefit of their teeth being easier to brush and
Yeah.
easier to clean, and there's less nooks and crannies that can accumulate tartar and calculus, which would give them gingivitis or gum disease over their lifetime. And so,
Mhm.
and then teeth that bite together well are more compatible and don't wear as quickly or break as quickly. So with Invisalign, there's both a health and a cosmetic benefit. With things like BioClear, the good news and the health benefit of that is that you don't have to grind on any teeth to
Mhm.
get the look and the appearance of porcelain veneers. And then with porcelain veneers, the health benefit usually comes in terms of whether there is some old fillings or broken teeth. You get to have them rebuilt and strong and easy to clean again. So there are benefits to cosmetic dentistry, along with probably one of the biggest benefits is a psychological feeling of
Mhm.
happiness. So when you feel good about your smile, you feel good about yourself. And when you feel good about yourself, there's kind of a euphoric uh, influence in yourself, and you walk with a peppier step, and you walk into a room with more confidence. So there is those health benefits, and I think that's really why people come to get cosmetic dentistry,
Mhm.
is they not only want to look better, but they want to feel better about themselves. And so that's a huge psychological health benefit to patients. So thanks for asking that question,
Yeah,
Sabrina.
of course. I think that's great.
So at this point, you have options and you have costs. And then an important thing is, once the patient kind of decides on, the one way they want to go or the two ways you want to go, the cosmetic dentist should be able to show that patient a case like theirs. And for instance, with the patient I just showed, Rebecca, we showed her a case where we just worked on her forefront teeth. Um, and then we showed her a case where the patient was missing bicuspids like she is, and we widened and straightened a smile with porcelain veneers. So she gets to see what her smile might look like. And again, that helps them decide whether they want to go with just 4 teeth and the same color, or whether they want to
Mhm.
go with 10 teeth and a wider color.
Yeah.
So that's one way we do it. And then lastly, before the patient is turned over to my treatment coordinator, we actually show them an imaging of themselves
Oh, wow.
that actually shows their their face with the kind of teeth we proposed. And so
Mhm.
in that instance, I'll show this case that we talked about, the gentleman that had worn his teeth quite a bit. Um, and that was Jay. And so we showed Jay his full face for our listening audience, his full face before, and then we cosmetic imaged some teeth in, similar to how he talked, how wide he wanted them, the length, the width, all that kind of thing, and then let the patient see that and see how they feel that looks on them. And as they see how it looks on them, they might critique it. And that's
Mhm.
okay to critique it, because that gives the cosmetic dentist an idea of more you want, and you start centering on what the patient wants as a result.
Oh,
And in this instance, the patient liked the whiteness, but
yeah.
he didn't like how pointy his eye teeth were, or the canines. And so we learned from him that, while when we do his smile makeover, we're not going to have pointy canines,
Okay.
but we are going to have the white teeth, which seemed a little too white to me, but
Mhm.
that patient chose that.
Mm-hmm.
So
So cool.
showing a case like theirs by the cosmetic dentist is important. And then even showing an imaging of what that exact patient would look like with the treatment they're thinking about helps the patient know the value and whether that's something for them. And that's all we want to come across with is the possibilities for the patient and for them to know the possibilities of cosmetic dentistry so they can decide whether it's for them or not for them. And that's okay with us cosmetic dentists, and it should be okay with the cosmetic dentist you see, is not to be married to whatever treatment they're recommending to you. The treatment should be offered, and then the patient should decide. So any thoughts or questions with that, Sabrina?
I think it's so cool that you guys can show what the teeth look like in the patient's mouth, because I feel like maybe in your head you have an idea, but sometimes, your thoughts don't always coincide with what actually happened. So I think seeing what it could look like and critiquing that and making sure that it's something that you want is super important. I really like that aspect of, having that assurance of figuring out what you'll look like in the future. Because of course it's going to be a dramatic change and you're going to have a brand new smile that you can like smile confidently. So you want it to be perfect.
Yeah, exactly, Sabrina. And that is a big commitment whenever you commit to this. And so you want to go into it with your eyes open. And it's just been in the last 3 or 4 months that we've been able to do these cosmetic imaging, while the patient's here. In the past, I've had to send it out and get it back in a couple days.
Okay.
But we've found that, again, even if the patient doesn't like them, it helps us know and communicate better with the patient. So with whatever they decide, we know it's going to make them happy. And that's how you have to feel with your cosmetic dentist, is that you're communicating well and he or she is repeating back to you what you're trying to tell them and showing you what you're trying to tell them. So that's fantastic to have that kind of communication. So the last thing about this, after they've told you about the different things of tooth structure and cost and how many appointments, at that point usually the consultation would be turned over to the team, and the team would go over the costs again of the 1 or 2 options that were given, and then the patient lets us know how they would like to proceed, whether they want to think about it, talk to their husband, or it's something they want to sign up for that day. And so that's where the team member and them being understanding and knowledgeable can really help the patient make the best decision for themselves, because a lot of times patients don't want to ask certain questions in front of the doctor. And so that's why I'm really happy with our team members, and that they're humble and they're open and they listen to whatever the patient's concerns might be. So again, having a good cosmetic dentist and a good team members that work with a cosmetic dentist is a feeling you should have at the end of your consultation.
Yeah.
And at the end of the consultation, you should feel like you've gotten a lot of information and you have a lot of ideas of which direction you'd like to go. And then again, it's up to the patient at that point to decide.
Sounds good. I think the biggest emphasis that I am taking away from what you're saying is that the patient should really come in with their ideas, and then when they leave, they'll have their ideas combined with your ideas and just like be completely informed about the entire process. And I think another emphasis that I took away was that they should have options that they can choose from. So it's not just a one-way path that they have to take. And I think that's so important because, you want to choose what you want and what you're comfortable with and what you think will look best. So finding a cosmetic dentist who will give you those options is so important.
Yeah, no, that's a great summary, Sabrina. And again, my summary would be the patient should feel very informed and they should not feel pressured in any way. And it should be kind of in their hands at that point to decide how and if they want to proceed. And they should see the benefits of a great smile if that's indeed what they want.
Yeah, I think that's great. And I think it's so good that you let patients know what they should expect during a consultation, because I think people come in with a certain idea, but I think it's great that we're emphasizing what they need to know, like so that they can get their information down and of course get your dream smile with cosmetic dentistry.
That's exactly what we're about, Sabrina. You hit the nail right on the head there.
Right?
So I'll let you close things, but I surely enjoyed talking with you today and explaining some of the nuances of how you should feel and what you should know after you've been to a cosmetic dentistry consultation.
Well, thank you, Dr. Eshom, for sharing your great knowledge about consultations and cosmetic dentistry. If you have any questions about your smile or cosmetic dentistry in general, be sure to click the link in the bio for the questionnaire where you can submit your questions or scan the QR code on the screen from YouTube. Other than that, be sure to subscribe to our podcast and leave us a rate and review on Apple Podcasts. And we can't wait to see you guys for the next episode. Bye.
Bye-bye, everybody.
Thank you for tuning in to Getting Your Dream Smile with Cosmetic Dentistry with Dr. David Eshom. Be sure to subscribe to our podcast to be notified about future episodes. Click the link in the description to fill out a form if you have any questions on cosmetic dentistry or your smile that you want us to answer. See you next episode.